What sort of cardiac tumors can cause acute arterial occlusion in general? Atrial myxomas. If your patient has a myocardial infarct, the traditional STEMI form, what should be initiated within 90 minutes? Percutaneous intervention. What sort of diuretics can cause hypokalemia? Loop diuretics can cause hypokalemia. If you see valgus laxity, should you be concerned of a MCL injury? Definitely. What sort of test should be ordered for someone with new onset psychosis? A urine toxicology screen, first and foremost, for the most part. Do patients with type 1 diabetes mellitus present with hypoglycemia or hyperglycemia? It's a trick question. But beware of hypoglycemia because that is what usually leads them to be in the ER. In order to prevent contrast-induced nephropathy in someone that's about to get IR or something, what should be performed? An IV saline infusion before and after the scan. What is the first step in managing splenic rupture? Volume resuscitation. Volume resuscitation is the first step in managing splenic rupture. What sort of defect should be suspected in a patient with recurrent bacterial infections? A humoral immunity defect should be suspected in a patient with recurrent bacterial infections. Patients with gastric bypass surgery are at increased risk of what sort of deficiencies regarding vitamins in general? Fat-soluble vitamin deficiencies. You get a gastric bypass surgery, you're at risk of fat-soluble vitamin deficiency. When treating poison ivy, what is one of the first steps um, in treatment? Obviously, to remove the contaminated material or apparel or clothing. A patient with microcytic anemia and anisocytosis should get what? They should get a fecal occult blood test. Do sound patients that think clearly have the right to refuse treatment, diagnosis, healthcare in general, and knowledge of results, etc.? Yeah, yeah, they do. They don't, as a physician or healthcare practitioner, you don't have the right to force someone to get treatment or a diagnosis or force them to know the results. They have the right to refuse. What IV medication helps treat acute hypoglycemia? IV calcium gluconate helps treat acute hypoglycemia. If a person's well score is greater than 4 but a VQ scan is negative for a PE, does that patient likely have a PE still? Yeah, it is likely that they do. So with that in mind, the well score is better for determining if someone has a PE opposed to a VQ scan, surprisingly. What is the general antibiotic treatment for acute bacterial sinusitis? Amoxicillin clavulanate for 5 to 7 days treats acute bacterial sinusitis. Patients on warfarin should take it as directed with. Patients on warfarin that take it as directed, that have subtherapeutic INRs, that gets a DVT should be started on what? Intravenous heparin. Note that antipsychotics for demented patients is good in the short term, but what are they at increased risk of getting? Increased mortality risks, right? What test screens for Cushing syndrome? The dexamethasone test screens for Cushing syndrome. What are some complications of arterial cardiac catheterization? Hematomas, pseudoaneurysms, and AV fistulas are potential complications of arterial cardiac catheterization. Patients with incidentaloma adrenal mass should have what? They should have their 24-hour urine catecholamine levels checked. Are condylomata sexually transmitted? Yeah. Condylomata acuminata is a sexually transmitted disease. How is condylomata acuminata treated in general? With chemicals, with physical removal, immunologic, and surgical, right? Basically, get it off. Note that root cause analysis involves gathering data on the issue as one of the first steps. A patient with polyarthralgia and fever presents to your clinic. Should you have chikungunya fever on your differential? Yep. Get that travel history. Obviously, empathize with patients and explore their feelings and rationale. If you have a patient that has giardia, what should you have them avoid? Open water areas, right? You don't want your patient that has giardia to be in some like fountain area playing with a bunch of kids and stuff. Does Alzheimer's typically get better or worse with age? It gets worse, right? There's no cure for Alzheimer's, and the condition typically worsens. What is the best predictor of severity of pancreatitis? What lab value? The blood urea nitrogen. BUN is the best predictor of severity of pancreatitis. Mitochondrial encephalopathy with lactic acidosis and stroke-like episodes is associated with what? Mitochondria dysfunction. So it's a common mitochondrial myopathy, and it's actually called MELAS. If you suspect that your patient has Sjogren's syndrome, what sort of workup should you get in general? Well, you should measure the anti-Rho SSA and the anti-La SSB antibodies for starters. B-cell non-Hodgkin's lymphoma is what people with Sjogren's syndrome are at risk of getting, by the way. So if your patient has Sjogren's, what sort of lymphoma are they at risk of? B-cell non-Hodgkin's lymphoma. How do you treat C. diff? Oral vancomycin. What is the best way to prevent the spread of C. diff? Hand hygiene. A patient with asthma exacerbation should get what medication? Oral corticosteroids. If you have a patient who is doing yard work, rose pruning and whatever, and they have a non-purulent ulceration with lymphatic chain involvement, what do they likely have? SS, Sporothrix schinki. Patients that were in a fire and/or inhaled smoke are at risk for what sort of edema? Supraglottic edema. A patient with concern of ventilator-associated pneumonia should get what sort of workup? They should get a tracheobronchial aspirate for culture. Patients with HIV often get what sort of lipodystrophy? They get HIV-associated lipodystrophy, And that's due to insulin resistance. And in general, how do you treat HIV-associated lipodystrophy? With a statin. Adios.